Phashalo video conference ni bisingtei hasteni kaitham hangkhorni integrated public health laboratory system ni Holongthai Phiyogwi Rwkha Union Minister Dr.Mansukh Mandavia Agartala Pragnaba banalo ajijak o video conference pandao manjaka hasteni montri okra Dr. Manik Shaha
A big round of applause for Dr. This is a precious moment for Dr. having been campus.
Lukorok ni health ni treatment ni bagai shalbrum no shakthar mongna harik tongo haktor hapang te haste hapang abo haiken of Phashalo video conference ni bisingtei haste ni kaitham hangkorni integrated public health laboratory system ni Holongthai Phiyogwi Rwkha Union Minister Dr.Mansukh Mandavia Agartala Pragabo bono loai jijak o video conference pandao manjaka haste ni montri okra Dr. Manik Shaha a kaitham hangkor ungkha North Tripura unokuti te gumoti Phashalo video conference ni bisingtei Tripura hastino karibo notice ni kaisini hastini joto montri okra rognotui public health laboratory system ni Holongthai Phiyogwi Rwkha Union Minister Dr.Mansukh Mandavia abun yaglo pandao kok sanan thangai hastini montri okra shaka
शिक्षा अनुसंधान को बढ़ावा देने के लिए भारत सरकार ने राष्ट्रीय औषधीय शिक्षा व अनुसंधान संस्थान नाइपर्स की स्थापना की। आदरणीय प्रधानमंत्री श्री नरेंद्र भाई मोदी के नेतृत्व में 6 नए नाइपर्स अहमदाबाद, गुवाहाटी, हैदराबाद, रायबरेली, कोलकाता व हाजीपुर का निर्माण कार्य प्रारंभ हुआ है। नाइपर गुवाहाटी की शुरुआत 2008 में गुवाहाटी मेडिकल कॉलेज एवं हॉस्पिटल असम के देखरेख में हुई। वर्तमान में 42 एकड़ में फैला यह संस्थान कामरूप जिला के सिला गांव चमसारी में स्थित अत्याधुनिक सुविधाओं से संपन्न अपने स्थायी परिसर से संचालित हो रहा है।
Namaskar and a happy morning. In this auspicious program, virtually we have with us Dr. Mansukh Mandavia ji, the Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Government of India. Sri Bhagwant Khoba, the Honorable Minister of State, Ministry of Chemicals and Fertilizers and Ministry of New and Renewable Energy, Government of India. Honorable Chief Minister of Assam, Sri Hemanta Biswa Sharma ji, and Sri Avdesh Kumar Chaudhary, Senior Economic Advisor, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India. Along with all the respected dignitaries of other states and the dignitaries of Tripura on the dais, everyone present here physically, especially the friends from print and electronic media, I extend my greetings to all the dignitaries and participants in today's program. Today I am very delighted to be present here in this auspicious program of laying of the foundation stone of integrated public health laboratories IPHL under Pradhan Mantri Ayushman Bharat Health Infrastructure Mission at North Tripura, Unokoti and Gumoti district hospitals. With the goal to ensure health for all, the state government under the guidance of our Honorable Prime Minister Sri Narendra Modi ji and Government of India had been relentlessly striving to reach out to the people with special emphasis to the tribal population as well as the people living in backward areas. In regards to the aim of the health department of providing accessible, affordable and quality healthcare services to the people, Government of India launched free diagnostic service initiatives in addition to the testing facilities available under various programs. Now, to augment and strengthen the competency for quick testing, case detection, surveillance and outbreak management, setting up of integrated public health laboratories as one of the interventions under Pradhan Mantri Ayushman Bharat Health Infrastructure Mission has been envisioned. Integrated public health laboratories are a relentlessly new concept in public health aiming to improve disease surveillance, diagnosis and response at the district level. They essentially combine various laboratory services under one roof, offering a more comprehensive and efficient approach to public health testing. IPHLs extend to a laboratory systems providing comprehensive services including infectious disease diagnostics and other diagnostic services such as hematology, clinical chemistry, microbiology and pathology, all combined under one laboratory service.
Awai samung budang ni bisingte dakti no bemar hamya rokno shinui mannai te dakti no hamrui bo mannai aboni bagai belai no khatong laijak tabok hastin joto tong kosong lukuro
हेल्थ सेक्टर से जुड़ा एक पूरा इकोसिस्टम विकसित हो रहा है। पीएम अभियान ने 17,800 ग्रामीण इलाकों और 11,000 से अधिक शहरी आयुष्मान आरोग्य मंदिर को मजबूत करने के लिए प्रतिबद्धता दिखाई है, जहां कॉम्प्रिहेंसिव प्राइमरी हेल्थ केयर की सुविधाएं दी जाती हैं। शहरी और ग्रामीण दोनों इलाकों में 3,382 ब्लॉक सार्वजनिक स्वास्थ्य इकाइयां और जिला स्तर पर 730 एकीकृत सार्वजनिक स्वास्थ्य प्रयोगशालाएं भी पीएम अभियान का एक महत्वपूर्ण हिस्सा है। पीएम अभियान ने पूरे देश में 602 क्रिटिकल केयर ब्लॉक यानी सीसीबी बनाने की कल्पना की।
Rwkha Khorang Nishmi Probirni Kok Thum Chini Khorang